So let me introduce Dr. Leslie Becker-Phelps. She is a therapist, an author, a speaker, and a teacher, and she's the author of several books. Insecure in Love is her first book, and then Bouncing Back from Rejection. And she has a third book on the way, which is being released in April, called the Insecure in Love Workbook. And we'll be sharing links to those books towards the end of today's webinar. Leslie also has a blog called Making Change for Psychology Today, and she wrote the relationship blog for WebMD for over 10 years. She's on the medical staff of Robert Wood Johnson University Hospital, and she served as clinical director of the Women's Psychological Services and chief of psychology. So welcome, Leslie. How are you today?
I'm doing great. Thank you very much. And you know what? Thank you for inviting me today. I'm really excited about us talking.
Well, our pleasure. We're looking forward to this topic. It's so, as I said, it's so relevant. It's something I certainly see in my practice all the time. So to kick us off here, tell us a bit about how did you come to be interested in working with rejection?
Really, my interest began with attachment. So I worked as this clinical director of a women's trauma program, which became the Women's Psychological Services later, which is what you referenced. So it was an inpatient day program, and then we expanded out. But we work with women with histories of significant physical, sexual, emotional abuse. When I left there and I was doing different things, I found that whether I was working with a different population, different diagnoses, I was thinking about different treatment approaches, whatever I was doing, I kept coming back to what kept these women that I had worked with in the program from being able to change, from being able to heal. And no matter what I did, I would always come back to, but would it work for these people? And if not, why? And as I researched and I explored, for me, it made a lot of sense to come back to attachment theory as a basis for people's struggles. And we all have our own attachment styles. Some people have more trouble than others. Connected with insecure attachment is rejection. We all have some struggles with rejection, but those people who have greater struggles with rejection, it's tied to their insecure attachment styles very often. And so that's what kind of brought me around to that, is seeing rejection kind of almost ubiquitous. And then in my mind, the kinds of work that I've done and what I've written about, this connects very well into that.
Yeah, that totally makes sense. I'm even thinking of recent clients in my practice where one partner turning away from the other, or doing something that's perceived as rejection, is experienced as incredibly painful, and for the other partner the same behavior is not an issue. And so I think you're touching on there the different attachment styles that people bring into relationships.
Yeah.
Mm-hmm. What are the common issues related to fear of rejection?
So with fear of rejection, it's really, again, if you think of attachment styles, right, and people's struggles there, very often it's related to, there's something inherently wrong with me. So I am flawed in some essential way. So the fear of rejection is because you're going to be rejected because you're flawed, and or seeing others as being rejecting. They are not emotionally available to you. There's a way of looking at attachment styles as a combination of a model of self, right? Who am I? How lovable am I? And model of others. How available are they? So people who are sensitive to rejection tend to, from the outside, it looks like they're just overreacting, but it would make sense once you understand them. And they may shut down, withdraw. So you see a lot of people who come to therapy, they're miserable, but part of why they're miserable is because they have withdrawn from interaction. They may just kind of emotionally shut down or become angry. So they'll be very quick to being angry. They'll read rejection and they have that bias. So a benign situation, they'll see rejection. They're turning what I would call a little R very often into a big R. Right? So somebody doesn't laugh at your joke. A friend shows up late because there was a car accident and they had a hard time, getting to dinner. for people who are particularly rejection sensitive, they're going to see that as a big rejection of them. And then you have people who just who are more avoidant and will push it away, and I don't have a problem with it, and yet you see them reacting that way. So there's a lot of manifestations, but those manifestations are really a way of protecting themselves from that perceived rejection.
I was also thinking that because it can also depend on the person that you're relating to or in relationship to and their attachment style, which might affect your behavior and how you behave with different people in different situations.
Absolutely. I mean, I think we all see that in our lives, and I do a lot of couples therapy, and Clinton, I think you do the couples work, and you see it there a lot. People are just push each other's buttons even when they don't mean to. And actually that's, for me, is part of the fun of couples counseling, right? Is to try to help people through when they're having trouble just sitting next to each other. But I think you're tapping into something very real.
So Leslie, can you say a little bit about how do you start to help individuals recognize some of these patterns, whether it's self-criticism or self-loathing that are often linked to their fears of particularly romantic rejection?
So I think it's whatever treatment approach you're using, you generally are starting with self-awareness. So you're psychodynamic, you may focus one way, you're more cognitive behaviorally oriented, you focus another, but all of us are trying to say, hey, what's going on inside of you, when we bring their awareness to that. And that's going to be the case with this too. I've developed a way of helping people expand their self-awareness using the acronym STEAM. So it's sensation, S for sensations. What do you sense in your body? T for thoughts. What are you thinking? What do you think about what you're thinking? E for emotions. What are you feeling? A for actions. What are your actions? What are your reactions? And then M for mentalizing, and we could talk about that a bit. That's some people may not know about that, but that's a way of pulling all of this together. So I help people by first working with them to get to know what their experience is. Because as people get to know themselves, they can start to have empathy for themselves. They get how it is they're reacting. They start to make that difference between my partner or former partner was doing something that was really rejecting versus, oh, they weren't really being rejecting, I'm just feeling that way. And they can start to look at that. Or, okay, yeah, they were rejecting, but they were rejecting with a small r, and I'm like taking it like this. But it all of that comes through essentially that increasing that self-awareness. And I think we have to do it in a lot of different domains so people can fully empathize and have compassion for their own experience and begin to work through differently within themselves, as well as with the other person. Again, for me, attachment theory is the baseline. So I'm looking at their model of self and their model of others and working on both sides of the equation. So for them to be able to basically do the STEAM model with their partner too. And that helps them work through. Does that make sense? Am I answering your question?
Yes, absolutely. And I think you're also beginning to touch on the next question I had for you, which is where does self-compassion, where does that lie in this model? Clearly, we want to help build people's resilience to rejection. Is that an important part of the model for you?
Absolutely. I think you're right. It's touching on it. So the more you have this awareness, this empathy with yourself, the more you can have compassion for your experience. We know people have greater resilience if they're able to have compassion. Because if you're struggling with something and you can approach yourself in a positive way, have that positive relationship, then you can support yourself and walk yourself through whatever rejection you're feeling or rejection you're carrying from the past to the present. If you have the self-compassion, because if it's not self-compassion, you can have a whole lot of self-awareness, but you can use that self-awareness to beat yourself up. Just intellectually think about it and pick yourself apart. So it's the knowledge from here, but it's all those different domains that I said. That's what allows us to then, or to help our patients move through and be able to separate themselves from the sensitivity to rejection.
And Leslie, how do you begin to cultivate that self-compassion with your clients?
I do it by, as we all do, we want to connect with the person, right? You're there, you're connecting with them, and you're building steam. I mean, it's amazing how well that works as you are. If you're really with your person and you're walking through it with them, and you're like, especially there's a lot of people, I should really back up, especially when there's trauma, but even short of what I would consider true trauma, people often live from here up, like they're here up and they're not connected to their bodies. So as you start to say, like what's going on, and they're connecting more, it brings their experience in more powerfully. You're responding in a more powerful way. And so you're trying to become that safe place. In attachment speak, you're going to be a safe haven. You're going to be a secure base for them to feel safe, then exploring like, oh, wow, was he really rejecting me that much, or was I overreacting to that? And generally when they say, oh, I overreact, I say, well, you only overreact if you're looking in the wrong place. If we can understand what's going on, it's no longer going to seem like an overreaction, and we help them move in that direction. So it's opening the self-awareness with heart and mind with them that helps move them towards the compassion. So now if they start getting very critical of themselves, which happens often with people who are sensitive to rejection, they're going to start coming up with reasons why somebody should reject them. I will pause them and I'll say, well, help me to understand. And I use that whole curiosity model that I'm sure as therapists, most of us use, right? You get curious what's going on. And I start to challenge in those gentle ways. I can remember, for instance, working with a woman who, gosh, in my mind, I thought she was very pretty. She certainly was accomplished by anybody's standards, but she would just talk about herself as a failure. And she's a failure, and nobody would want to be her friend. And, she had no, she didn't say she had no friends. Nobody wanted to really be her friend. I remember saying to her once, I'm sorry, I'm confused. She was like in her 50s. I'm like, if nobody really cares about you, which was her premise, how is it that your friend, who you've known since college, keeps calling you back? Like, she keeps calling and trying to, surely if she didn't like you and didn't want to be your friend, she could have found a way to ditch you by now. So I just really don't understand. And I did it in kind of it wasn't a gimmicky way. It was a genuine, like, help me get this. And she didn't say, oh my gosh, you're right. Like, my life has changed. But it did put a bit of doubt in. And I think that as therapists, when we can genuinely kind of be curious with them, we're not going to see the change right away, but we'll see the beginnings of doubt and the willingness to open up and to explore. And as people feel safe, maybe sharing some of the painful things, the scary things, and it expands out from there. So that's how I do it. And again, I keep an eye towards, as I'm doing it, towards steam. So if we get stuck someplace, like if someone is, I realize that they are so not connected to their bodies. I'm like, okay, I need to do more work there. So I start doing work there. And I'm a very big advocate on integrating different treatments. I have not, any of the work that I do, I did not create it. I have just organized it in a way that makes sense to me, at least. And it allows for integrating different treatments rather than using treatment eclectically. So like if I'm aware someone at the S level of sensations is disconnected, I might turn towards the things that we know, breath work, yoga, might use Peter Levine's work, Pat Ogden's work, because we're like, okay, we need to connect there. But let's say they're kind of connected and they're going there and they have no idea what their emotions or their thoughts are. And I don't do them in order, but I do look at all the domains of steam, their sensations, their thoughts, their emotions. And when we've gotten far, I'll integrate the other one and bring it together. And in the domain of understanding themselves, we're talking about rejection. So that involves often other people. Sometimes people have struggles with rejection. They don't need another human being. They just do it all by themselves. But generally, it involves others. So then we use the STEAM model for others so they can get what it is that they're taking in. I just gave you a whole big mouthful. Does that make sense? Do you have questions?
What was the A? Someone's asking what the A was.
Huh? Oh, the A,
Steve.
actions. So we have
Action
sensations,
and
thoughts,
mentalizing.
emotions, actions, and mentalizing. Right.
And mentalizing is the how you put it together in your mind.
Okay, so mentalizing, and I promise you I did not come up with that term because I will say that it's such a jargony kind of term, but we look at the work of, I'm talking about integrating the work of Peter Fonagy and colleagues, and they developed mentalization-based treatment, which was really developed for people with borderline personality disorder, but could be used across different disorders. Mentalization is when you really understand, so you can understand someone's actions if you understand what's going on for them internally. So if you understand their mental states, their thoughts, their feelings, their fears, their fantasies, whatever all those things are that's happening in them, if you really fully get where someone's coming from, you get how it is that they are acting the way they're acting. You have empathy, you have compassion, you have openness to forgiveness. And when I say get it, I don't mean just intellectual. So we would call that pseudo-mentalizing. You intellectually understand why they're doing this from head and heart. So in your head and heart, if you get where someone's coming from, then you're able to mentalize. And yes, I use the STEAM model. I would use STEA, sensations, thoughts, emotions, actions, as a way of trying to get what's going on inside of them. And then they can relate and develop that empathy and that compassion from there. That's the mentalizing. That's the pulling that together and making sense. And it gets trickier when you work with couples. So we're talking about rejection. Certainly within couples, they often bounce off of each other, both feeling rejected. So it's a matter of being able to mentalize themselves and mentalize their partners. So we have a lot going on. Mentalizing yourself is getting your head and heart inside of you. If you can imagine like a picture, a person, head and heart inside of themselves, their partner, head and heart inside of themselves, and then being able to do it back and forth with each other. If you have couples who can do that, they will do much better in terms of the rejection. They'll be able to calm those fears and also develop a healthier relationship.
Is there, can you explain how somebody might apply this to their everyday life or to a couple who's at home and not in your session, for example?
So the way to apply it is for people to really practice being aware on the different levels. On my website, I have like an information sheet where it just explains what each thing is. I will have people, when they go home and there are particular incidents that happen, if somebody knows they're sensitive to rejection, there might be a situation where they felt rejected. And we'll say, you know, like, I want you to think about this. What did you notice in your body? Here's what I learned since using this method. People are often very confused about what's going on with them. I'll say, what do you sense in your body? And they'll say, I was sad. I'm like, that's great. That's a wonderful emotion. And what did you sense in your body? Or I'll say, you know, what are you feeling? And I'm feeling like he thinks I'm such a jerk. Okay, that's a great thought. And I do think it's important to separate it out because when you don't, not that I really care if somebody has the wrong term just in and of itself, but if you pay attention, the misnaming of whether something's a thought or an emotion or a sensation, that may be indicating to you that they are actually not connected in. So if they're always using emotions to say what's happening in their body, they may not know what's happening in their body. Or they're always using thoughts to express their emotions, they may not know their emotions. And so that's how I help people in their everyday lives. I have them just really attend to these different areas. And it's amazing how enlightening it is. And separate from rejection per se, I was working for a long time ago with a woman who had very insecure attachment style and always expected people to think the worst of her. And she struggled with depression, not surprisingly, for a lot of years. And we were working on the emotions, and I have an emotions list, which actually people can get on my website. I have labeled different categories, and then you can look under the categories for the emotions. She said, can I take the emotions list home with me? Which I always encourage people to do. She took it home. She came back the next week. She said, I had no idea there were so many words for happy. So we had been working on all the tough stuff, but when we started to, started to incorporate that more more, that was important, because if you're rejecting yourself and you only see the negativity, and this is for therapy too, if we only talk about the problems, then how can people grow into the healing? Because as soon as you start to talk to the positive, you don't talk about it, so then you're left with just the negative. So just kind of as almost an aside, but I think also important to this is we want to include the positive, the awareness of the positive. And sometimes that's part of this work, right? Is to heighten that awareness. Speaking of integrating, so different treatment approaches, one thing with thoughts, when people have trouble and it's all jumbled, sometimes, I don't know how many people are familiar with ACT, acceptance and commitment therapy, and they have a lot of great metaphors. They have the metaphor of the bus. So who's driving the bus and who's in the back of the bus, and all the voices in your head. And so sometimes I've used that to help people be aware of the different voices, which meant it teaches them how to be aware of the different thoughts in their heads. And of course, we can tie that to the different feelings that they're having. And again, just different ways of expanding that awareness, which then helps people get to the rejection. Because now I can understand how it is I'm taking in rejection. Is the other person really being rejecting? In what way are they being rejecting? What are my different responses? And when we separate out the event from the reaction, we have space for a response, right? And I didn't create that by any stretch, but we have space for the response. And that's what we're doing, is we're building in space for that response. Is that?
That's so great. I love that. I just love the way you explained all that, and just to how to assess where people may be stuck or not aware of different parts or different ways of expressing themselves. That's great.
I think one of the ways that I came to thinking about it this way, I remember going to a program on, it was a cognitive behavioral therapy program, and I said, this is great, there's a lot of helpful stuff here, but how do I know, because they were talking about different approaches, I said, how do I know which one I have to use? And the response was, well, it's all trial and error. And I really didn't like that. That's the eclectic, let me just grab whatever comes to my mind first and let's see what works. And for years, and I'm still looking, I'm still trying to fine tune that, but like, how do I know what to grab when? And for me, this is a way of organizing that for rejection sensitivity, but for all other insecurities that people have.
That's great, Leslie. Look, I think as therapists, we've all had that client who has experienced some kind of profound rejection. And I'm thinking of even a client perhaps who has been in a relationship and their partner has cheated on them. So there's been infidelity. And what we often see is that then there is this hypervigilance that can occur. So as that person goes through their life, and maybe they're dating, that relationship has ended, or they're forming new relationships, they become very, very sensitive and heightened to any possibility of rejection. This is what you were touching on before. Little R's become big R's. What's your thinking around that? Because there must be some neuroscience behind that somehow our brains are in a protective mode. And with those clients, how are you helping them regulate their emotion, to develop stronger emotional regulation?
Right. Excellent question, because I jumped over that whole piece. So you gave me a nice way into addressing that. We know that when people come in, they're highly emotional, and that's very often tied to feeling unsafe, right? That's what attachment theory is about. We need to attach in order to feel safer. They're feeling unsafe. And there is a lot of neuroscience, and one of the more popular things that have, with some real backing, that have come up is polyvagal theory. That's a way to think about this, is that when people's sympathetic nervous systems are activated, then they're not able to think straight. Or we could just go back to the more general, when the emotional part of your brain is lit up, the prefrontal cortex goes dim. We see that on studies. So for people to be able to do any of this processing I'm talking about, they have got to feel safe enough, calm enough. Their brains have got to calm down enough to absorb and work with you or work with me. So that's what we need to do. We need to give them the tools. So when someone first comes to your office, the look of your office is going to have something to say about how safe they may feel. You and how you present, you being, hopefully a safe person, and the way you're interacting with them, increasing safety. And then you can help them with tools. And we look at DBT offers a whole range of tools, right? Polyvagal theory, the work that's being done therapeutically. I feel like I'm like a spokesperson for all the different therapies out there, but I'm trying to find a way to integrate them in because they all have wonderful things, and we have to know when to use them. So somebody comes in, you see that they are in a defensive place, neurologically, biologically, in their body, in an unsafe place. So that's what you're going to focus on. It may be meditation. It may be learning to if they haven't been sleeping well, you got to attend to the sleep. If they're not eating and they're getting hangry, we need to help them with that. We need to bring awareness. What's making them feel unsafe? And so I'll listen to them and work with them around what they're struggling with and what can help them feel safer. Going out for a walk. We know nature is often comforting for people, or a hobby, or breath work, whatever it is. We're going to work with them. We're going to work with them not for them to rely on you, but that they can then take those tools with them. And that's really that's a beginning. They can now work with you, but they can work with themselves and have a sense of agency in themselves and as they go into the world. And that is in my mind, it's a continuation, what we all do all the time, hopefully in our lives. Stressors come up, we comfort ourselves, we comfort our brains. But it's also a beginning for being able to really explore further. It allows to come back to some of the stuff I've talked about before. If someone is in a state of threat, feeling threatened, they're sympathetic, nervous system is engaged, or they are in an escape mode, more of an escape mode, we need to help them to be able to see it. When they can see it, they can begin to start mentalizing. People cannot, remember STEAM, the mentalizing on STEAM? People can't do that as long as they're in threat mode, because if you're doing the essential of seeing a hungry tiger in front of you, you're not really going to be thinking about anything else other than how do I deal with this thing coming at me? You're going to be panicked or something. So we've got to calm that first. So I think that's the answer. And yes, there's a lot of neuroscience that's being done. So we've got the polyvagal theory. Dan Siegel talks about the window of tolerance, and I will use that with people, right? Are you in your window of tolerance, or do you feel like you're outside your window of tolerance? You can't tolerate what's happening, so you can't think straight. AKA you can't mentalize because you're too activated. And so we need to bring that in so that we can do some of that other work then. And some of that work then helps you to continue to be able to do that. So they do something that they can get to that will calm them. And then you might be able to help them see that their sensations, they're actually still activated, but they're calm enough that they can see it. They can finally see that, oh yeah, you know what? My heart is beating fast. I'm thinking this may be what's going on. And then you're still bringing it down, but you're engaging them more on other levels. How am I doing?
Thank you.
Great.
That's
great.
fantastic.
Great. When some clients might be having difficulty facing their feelings of rejection or what's happening for them, how do you help them lower their defenses?
You join with them. I mean, I think that what we've all been taught, we be with them. And then, I think most of the work in therapy is done in the gray zone. It's not the stuff people know and can talk about and are great with. And it's not the stuff that they don't totally know. It's that in between. That's the part that's uncomfortable. So I encourage them to reach a bit. So if there's something I think they can get to, I will ask questions around it or have them just explore so they can get there. But if they seem blocked, I always think of it as like tapping it in. I'll say, gosh, if I were in your shoes, I might feel blah, 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 blah. Or like with couples, I can remember saying, I had a gentleman who really was very shut down in the couple session. I knew from the way his wife spoke, I knew he was feeling hurt and rejected. And so I'm like, what's going on? Nothing. I'm like, any reaction? No. I'm like, how about the tear on your face? Oh yeah, I don't know why that's there. I mean, he was really shut down. And I'm like, okay. So I have to say, if I were sitting in your shoes, I would be feeling really hurt. And I then explained it. So as a couple, that's what I worked, and that intervention did work in that particular situation. With individual, I'll do the same. I honestly, and I know different people work differently, but for me, I use my body a lot. So I will feel the sadness. I mean, if somebody looks totally fine, but I'm like all of a sudden feeling like I want to cry, then I will share that with them. I will say, I don't know what's going on. You're talking like everything's okay, but I'm having this reaction. Do you understand what's going on for me? And it's amazing how often they'll say yes. You know, so for me, those are different ways of tapping in, like just putting it a little closer for them to be able to access, and then I hand it back to them to process, because obviously I can't do it for them. And if the truth is, when I do an intervention like that, if they don't get it, if I overreached, if I was just plain wrong, if I switch gears, it, generally speaking, goes past them. And the times where it didn't go well, and it didn't go past them, maybe they felt hurt or upset. That's great, because generally I like to think most of the time I don't do something like that if I don't have a base. So I will say, hey, wow, it seems like you had a reaction. And then we can talk all about their reaction. They can feel like I'm aligning with them. And then we've expanded. Either they've gotten the new insight, or that part was lost and we were able to just kind of come together. And I think that's advancing the therapy too, because you're doing that collaborative communication, which I think is essential. I don't think, which is essential in having a more healthy attachment. So.
That's great, Leslie. I wonder, could you share a case study with us of someone who helped overcome intense rejection sensitivity? And I just noticed in the questions there, we have a number of people just wanting to know more about STEAM. So I don't know if it's possible to incorporate some of your model in that, but we'd love to hear a case study if you have one.
Sure. So I'm going to use a couples case study, because I think that's always, it's interesting. It's always a bit more complicated. I had a couple who came to me, and she was really ready to divorce. She's just like, she decided to come, as so often happens with couples. They come in, they're like, okay, fine, I'm going to give it one last shot because I want to know that I did my part. So she came in that way, and he was he's a really nice guy, and really totally shut down. So he didn't know what he had been doing wrong, except that he did know he was a nice guy, and every once in a while he would explode in anger. And what it did was it built up in their relationship. She was afraid of him a lot, because even when he was calm, she didn't know when the anger was coming. And so she's feeling rejected. Meanwhile, he's shut down, I will tell you, because of his own history. When he was growing up and there was a lot of hostility in the family, and the way he learned to cope was to minimize everything, shut it down, make it tight, and, we're good. And he's just going to try to take care of people and be a nice guy. But if there's something upsetting to him, he'd bury it. So I talked with them about attachment theory a bit. And I talked with them, I gave them some information basically about polyvagal theory. And I said, I get the sense that, you feel threatened. And so we talked with them both, but for our sake, and make this more simplistic, I talked with him. So he at first didn't know what the heck I was talking about. So we had to get him in touch with, well, what are you feeling in your body? I don't feel anything. Okay, let's work on it. And so we worked for him to be able to feel his body. As far as he was concerned, he went from 0 to 100. And then as we worked, he was able to see that there was a growing experience. So then he was able to label that. Then we were able to tie the growing sense of the S for esteem is sensation. So we're growing the sensations. Then we were able to tie the emotions to it. Well, my body's tightening, but I'm fine. I'm explosive. So then we tied the emotion to the growing sensations, so he could see that. And then he was like, wow, I had no idea. So we had to process that, because it's a whole different way of seeing himself. So we dealt with that. And of course, actions are carried in. So when you are doing this, these are the actions. So this is what your wife and your children are seeing when you do these actions. And this is the effect on them. I'm really fast forwarding this therapy. I promise you it took longer than it's taken me to describe, but these are the effects on them. And then for him to be able to get the feedback from his wife, but then he's not really empathizing because he's not quite there yet. So, help her to be able to hang there for a bit while we help him be able to connect with his own emotions of what it's like to get the feedback, then be able to hear her well enough to be able to get her emotions. So now we've got sensations, we've got, thoughts were easy. So we can get those coming, we follow the thread of that through the thoughts, the emotions, the actions, and he's putting this together. And now he's understanding her more, because then we started to do it with her. Could he see this in her? So he's able to mentalize himself better, mentalize her. As therapy went on, he didn't understand where it all came from. We explored the history. So now he's mentalizing himself more fully, deeply from the history. In the meantime, she's still really upset because he's been so angry so much and it doesn't make any sense. And she's struggling with her own, what's wrong with me? So we do a similar process with her, not quite as deep, but also help her to be able to mentalize him, which is hard because he was angry with her for so long. So it was important to help her be able to know it's okay that for her to be able to express that she felt unsafe. And just because he has a history and his reasons to understand it, it's not an excuse that it's okay. So we're balancing all of these things, and really with time, then we would do exercises where they were more so a lot of this was done separately with him and then bringing it to the couple. Then we're able to do more of the couple stuff and address her fears of rejection, for her to see that, because she had it, he gets so angry all the time, she just absorbed it. So we had to help her be able to process that through. Does that make sense? Do you have questions? I know I blew through a lot. So if you have questions, I'm happy to answer. But I think that tells you STEAM, like how I used STEAM, and how we helped it through the treatment.
That was a great example. Someone just asked if that was linear, but I think you said before it's not necessarily linear. It just depends on the clients.
Linear meaning like doing sensations, thoughts, emotion. Yeah. Oh no. Yeah, I'm really glad they asked that. No, it's just that I need to be able to talk about it in a linear way. Mm-hmm. But really, I think of it as weaving together. So if somebody's really stuck on sensations, we do some in-depth stuff on what's happening in your body, and we pause there, and then we kind of weave it together. It seems like once you open the sensations, emotions often come next, or emotional thoughts, which is a combination of the emotions and the thoughts. We got to separate that out a bit. In fact, I should say I do a lot of work with people on understanding emotions versus emotional thoughts, which are, in my mind, it's the, I feel like such an idiot. And then it's like, well, what do you think objectively? Like if you were able to step out of it, I'm afraid of my partner cheating on me. And then you can step out of it. I can see that my partner, there's no reason for me to think that. They have no history of that. They're not flirting. They're not doing anything. But but that doesn't change it. I am afraid of this. And we can then hold them. We can say, okay, on the one hand, you're afraid. In your mind, you can see that's not really reflecting this situation. Where does that come from? We do the mentalizing. Oh, okay. The fear is from over here. This is where you are. And we just start putting curiosity and doubt in there. And that it doesn't change the experience, but it does lighten its grip and allows space for that healing and the change to happen.
That's great, Leslie.
Okay.
Let's just for time's sake, let's move to the questions now, because we have quite a few. I'm not sure we're going to get through them all, but let's see if we can answer some of them.
Sure.
We've got some great questions. And just before we jump there, we've just shared Leslie's resources in the chat there, because I know some people may have to leave early to get to a session. So just check out Leslie's website, drbecker-phelps.com, and we put the links to Leslie's 3 books. Are they the best places for people to get in touch with you and learn more about your model, Leslie?
Yeah, those are great. I also have my YouTube channel. So these are great because they're 3-minute videos. So for a lot of people,
Wonderful.
they can give 3 minutes to it. But yeah, those are my books, my website, YouTube. I think those are the best places.
Where do they, is it your name that they look for in YouTube?
Yep.
Okay.
One of the things I will tell you that I've learned at first, when I first got married way back when, I was like, oh, I shouldn't have hyphenated my name. It's too long. Now that I do all this work, there is only one Leslie Becker-Phelps, I think, on the planet. So if you put my name in anywhere, if I've done something, you're going to find me. You know, whether it's books like with Amazon, whether it's YouTube, wherever it is. So
Right. That's
turns
right.
out it's a great marketing thing, I guess.
Let's move on to the questions in here. Someone's asking, with ADHD, part of the symptom profile is RSD, or rejection sensitivity dysphoria. So much failure with this neurodiverse condition. One begins to expect rejection. How do we use STEAM to overcome this? Do we need a therapist, or is there a way to do self-work? That's a
Yes.
big question.
Yeah, that's a big question. Yes. I mean, I think, first of all, I think everybody can do self-work. And I do like to, this may sound like hair splitting, but I kind of think of therapy is also part self-work. The more somebody enters therapy thinking they have to do self-work with the guidance of the therapist, I find those people do better in therapy because they are more invested in making their own change happen. So again, you know, I not journaling does not work for everybody, but I think journaling can be great and structure. The STEAM model lends itself to structured journaling, right? So you just have the page. What's the circumstance? STEAM. And you can ask, like I said on my website, I'm sorry, it's hard to remember what I put on which pages. I do have a page called Compassionate Self-Awareness because that's really what I'm trying to develop. With compassionate self-awareness, people can nurture a secure attachment style. So on that page, I know there's a link to a STEAM information sheet. But it's basically what's the situation, sensations, and the question is what do I sense in my body? T, thoughts. What am I thinking? What do I think about what I'm thinking? E, emotions. What am I feeling? A, actions. What are my actions or reactions? Mentalizing. Do I get what it is that I'm experiencing or what I'm going through? Or do I get my partner? If you develop a journal and you have that, a person can work on STEAM, or they can choose to work on one part of it, like focus a bit at a time. So that's a way somebody can work on their own. I think if somebody is deeply stuck in a place, it often helps to have someone outside of you because you can't get outside of yourself. So if you really are enmeshed with the experience of I am a failure, sometimes you just can't get enough space to be able to respond differently. You just have the reaction. So sometimes you need somebody outside of you to help you with the space so that you can do that reflecting and that moving forward. So I think it's combination of those. And a word to a nod to attachment theory. We learn who we are through our caregiver's eyes, right? An infant doesn't know who they are. They learn who they are because of the reaction of the caregiver. And so then they learn to trust someone else, or they learn who they are. And so therapy is important in that the therapist then becomes someone that hopefully you can see yourself through their eyes. And it's a different way. It's a way of healing and changing your expectation of whether someone can be there for you and be supportive. Doesn't need to be a therapist, could be another person. But if you don't have a healing person in your life, the therapist becomes that much more essential.
Fantastic. Thank you, Leslie. Someone's asking, is your model applicable to traumatized people who may have cognitive challenges?
I guess it depends on what cognitive challenges. I'm not sure. I'm
It's
not
a
sure how to
fairly
answer the
broad
question.
Yeah.
Huh?
Yeah. Yeah, it's a fairly broad question, so that's pretty tricky to answer.
Yeah, I mean, as far as trauma, I mean, I came up with this. I think I found my way here, as I explained in the beginning, because I I was director of a trauma program, so people had some deep trauma, and I think what I found was all those different pieces weren't always there. So I do think this is very applicable, and this isn't like a particular therapy. I don't think of it that way. I think of it as a model, as a framework that invites in different approaches. So if someone's stuck in a particular place, it tells you where you might be stuck, and it gives you an idea of which kinds of interventions would work. In my mind, so many therapists have training, like a little training here, a little training there, a little training there, and we're trying to just, so part of this hopefully would help somebody put it together. As far as cognitive challenges, again, I don't know what the cognitive challenges are, but I think you adjust it to a person's level. I think that's the best I could say. I'm not sure how it would be more specific.
Are there any resources on rejection by social groups due to infertility or childlessness? I work in this area, and it's the most common presentation, being socially isolated and not belonging in a fertile world. That's an interesting form of rejection, isn't it?
That is, and people do have, it's not just that. I've worked with people who have had miscarriages. They've had to do medical terminations. I mean, talk about being in a tough group of a medical termination of a fetus. There are resources. It's been a while since I've referred, and they're not in my head. Resolve, is that the name of one of the groups, I think? But what you want to do is you want to look, just Google, because I know they exist, and I would have to go just quickly Google it to remind myself. But there are resources or organizations for people going through infertility, and you can get support groups through them, and also medical terminations. That's a harder group to find, but they exist. I would Google it. I would also go to infertility clinics or places that deal with these things, medical, and if they don't have it, they should, but a lot of them do have it, because those are the ones that I have worked with in the past. So.
Thank you. We're just coming up to our last question now. Juliet, do you want to ask our last question before we wrap up?
Sure. Of your books, which would be best for me to read first? I'm a generalist and I work in private practice.
Good question. So, if I were to pick, I would pick Bouncing Back from Rejection. And the reason is, when I did Insecure in Love, which I think people have found immensely helpful, if I can say that, with all humility, at least the feedback I've gotten. When I did Bouncing Back from Rejection, that's when it was during that time I developed the STEAM model. So STEAM is not in Insecure in Love. Now, in my workbook that's coming up, the Insecure in Love workbook, what I did was I took the resources from Bouncing Back from Rejection and I combined them with Insecure in Love. So the workbook actually does have STEAM. So when that comes out, that's great, because it's a workbook for it. So I introduce compassionate self-awareness and Insecure in Love. So that's done, at length there. The STEAM model is, if that's of interest to you, I would explore that there. And on my website, actually, if you sign up for my newsletter, I'm trying to think if it's on my website. It may not, but if you email me, I'd give it to you. There are some on-demand courses I've done on this approach. And so you can learn, more, like a full day course or anything, something like that.
Fantastic.
Awesome.
Thank you so much, Leslie. And someone's asking, when's your workbook coming out? April this year. So very, very soon. Very soon.
Very soon. And you can pre-order it. My publisher will be very happy that I said that. You can pre-order it.
Absolutely. The Insecure in Love workbook. Just check that out on Amazon. And thank you so much, Leslie, for sharing this incredibly valuable information. It's so applicable to many of the clients. It really is up there as one of the most common issues I'm certainly working with. And I'm sure lots of other therapists work with all the time as well. So we really appreciate you sharing your wisdom and your knowledge. It's been very valuable today.
Absolutely. Thank you.
Thank you so much for having me on here. It makes me feel good to be able to share this and to help the people who are helping the people, so to speak. And I hope people have gotten, at least some tidbits from this. And thank you.
You're welcome. And just before we finish here, we've got a couple of our own promotions. we have a free training on at the moment with Dr. Stephanie Bueller called Facts About Women's Sexuality, What Individual and Couple Therapists Need to Know. That's a fantastic free training. We encourage you to sign up for if you haven't. And coming next month, we do have an early bird list for our free training on internal family systems with IFS practitioner Colleen West, wonderful presenter. So check that out as well if you can join the early bird interest, and that will be released on March 5. So thank you, everyone. Wonderful turnout. Thank you, Leslie. Thank you, Juliet. And we'll look forward to seeing you next month. Juliet, do you want to quickly mention our webinar for next month?
Yeah, the next month we're going to be doing a webinar on helping couples recover from infidelity, which is kind of a related topic to today's. Mistakes to avoid and strategies to embrace with Linda McDonald. And if you're already on our support webinar email list, you will get all the information for that. And if you're not, you can sign up. I think I have the link here. Clinton, do you have the link handy? Or they can look in the Facebook group, I guess, below the video.
Yeah, I'll put that in the comments.
Okay, thank you, everyone.
Thanks, everyone.
Thank you, Leslie.
Thanks, Leslie.
Thank you.
Bye.
Bye.